Have you had lower back pain and done stretches and physical therapy, maybe even having an epidural and haven't gotten results? I wanted to spend a little bit of time today going over a study that may shed some light onto why you're not having success. I'm Dr. Greg Gerstin with Align Wellness Center, a chiropractor in Northbrook, Illinois, where I focus on posture biomechanics and understanding of complex spinal disorders. What we're going to go over today is a study that was published in the Journal of Spinal Disorders, and what they look to do is understand the differences between normal lower backs, acute lower backs, people who have had injuries to their lower back over short term, chronic lower back injuries, and then lower backs with spinal deformities, and the differences that we see in those spines. Now, the way that they classified these groups was that a normal spine was a normal person was someone who didn't have any lower back pain, who had no spinal deformities, whether it was osteoarthritis or anteriolisthesis, slipping forward or backwards of any of the vertebrae. They defined the acute lower back group as someone who's had an episode that did not last 6 months and did not wind up showing any congenital changes whatsoever. They did not have any degenerative changes, anomalies, or any shifts in the spine forward or back. Also, when you looked at them from the front, they didn't bend to the side greater than 10 degrees. Then they looked at a chronic lower back group, and they found this group by people who had pain in their lower back for over 6 weeks. And it was reoccurring in history. They also might have had problems with accident daily living or lost the ability to work some. This group did not have any pathological radiological conditions. However, they did have deviations from normal and would be problematic. So they didn't necessarily have any tumors, but they did have things like arthritis or a spondylolisthesis, slipping forward or backward, and they can also have a bend in their lower back. The group with the abnormal lower backs, they described as those with compression fractures, or that's where the bone collapses in the front typically compared to in the back and is smaller. They had osteoarthritis, they had transition segments and translations of greater than 4 millimeters. That means they shifted to the side either way greater than 4 millimeters. They also might have had shifts back or forwards and disc degeneration. They categorized them into these groups because this is the most common way that people wind up showing up when they have these problems and they look for investigations. Some of the interesting things that they really found was the shapes that the lumbar spine takes on when they fall into these categories. Now, they had 50 people in each of the groups except for the last group. And what they found was that the populations that fit into each of the groups they looked to match. So they had patients in their 20s that were mixed for males and females, but the same ratios for all the groups except for that last one. And I think they had difficulty with finding people that would fit that category, so they had to use a group that's average age was a little bit older, about 40. Those are the biggest difference between the groups. What they then did was they had regular x-rays that were taken for reasons of work or other reasons, and they digitized them, real similar to how we digitize here in our office. What they found was that each of the groups were really closely related in the curves that the spine had. Now, all of them had what's called a lordosis in their lower back, and that it curved front towards the front. That helps with architectural stability and shock absorption or distribution of force. However, what they found was that in the normal group and the acute group, they found that the spinal curve was about 40 degrees. What they then found was that in the chronic group, the curve wound up being, I want that exact number for you, it was 29 degrees. That's a big difference. That's almost 10 degrees of change in a normal neutral position. The last group with the anomalies or the pathologies wound up having an average curve of 35 degrees. So that's when we look at the spine from the side, measuring the back line of the vertebrae. I'll bring out my model if this is a vertebrae. From the top to the bottom, at the top vertebrae in the lumbar spine, and then the same thing at the bottom, and where those two connect, that angle. They also found that most of that curve occurred at the very bottom of the lower back, where less of it occurred at the top. They also found that the base that the spine sits on, the sacrum, it had specific angles too. Now, if you're wondering how this might connect to the stretches you've done, or the therapy you've done, or the medication you've taken, or epidurals that you've received, if you're still having reoccurrences of this problem, it may have to do with the shape that your lower back is in, not the necessarily lack of medications or exercises or epidurals that you wind up receiving. If you want to understand what your curves looks like compared to this study or compared to your normal or ideal, let's find a time to get together so that we can dig in, unpack and understand what your spine looks like, what the biomechanics of your individual body needs, and then see what it would take to move you towards that so that you can work better, feel better, live better, and enjoy life. Now, I'm Dr. Greg Gerstin with Align Wellness Center. If you like this video, please subscribe to our channel or like our Facebook page. We put together videos like this on research as well as other common topics at home, including activities and exercises to help make life easier for you all the time. You'll want to check back in or subscribe, and we'll send them to you immediately upon publishing. If you have any other questions, feel free to write them down in the links, and I'll be happy to answer them as soon as I can. Once again, I'm Dr. Greg Gerstin. If you have more questions about this article, please feel free to write them down in the post. Make it great.